I am Dr. Elizabeth Rider, speaking to you from Boston, Massachusetts. I will be talking about humanistic education and practice in the time of the pandemic, fostering values and compassion. I'm a pediatrician and medical educator in the Department of Pediatrics at Harvard Medical School and in the Division of General Pediatrics at Boston Children's Hospital. And I'm also a member of the International Consortium for Communication Healthcare and do a lot of international work. Thank you to Hedra for inviting me to speak today, and I'm delighted to be here. So I'd like to give you a roadmap or an outline of what we'll talk about today. First, we'll talk about the pandemic challenges to humanistic healthcare. We'll talk about values in healthcare, which is the foundation of our work. I will share with you the International Charter for Human Values in Healthcare, which is a framework to inform education, practice, research, and organizational change efforts. And then I'm going to present to you some of the research we're doing. What are we learning from research? And then take-home points. So now we're in the time of COVID. Where are we now? This information is from the World Health Organization. We have 300,000 million cases, 3.9 million deaths, and 223 countries are affected, essentially all countries. So the pandemic poses many challenges. There's loss, separation, and death, mental health challenges, lockdown, quarantine, social isolation. There's poverty, food insecurity, housing insecurity, domestic violence, abuse, neglect, and economic losses, loss of income, loss of jobs, and then disparities in care and racism. School closings have occurred at the peak in 193 countries, affecting over 90% of enrolled learners worldwide. That's more than 1.6 billion children. We've got necessary isolation and distancing that challenge communication and relationships. And the pandemic has posed many resource challenges. There have been many shortages in terms of intensive care beds, ventilators, personal protective equipment, medications, staffing, physicians and nurses, respiratory therapists, lab personnel, and that these shortages can lead to dilemmas regarding allocation of resources. So what happens ethically? Well, you have dilemmas with families and patients and impossible decisions. And the risk of moral distress, that happens, these are complex ethical challenges. It happens when you know the right action to take, but you can't take it due to the lack of resources, or you're conflicted about what course of action is right. With prolonged morally distressing situations, moral injury can occur, and that may lead to compassion fatigue and burnout. So hard resources vary around the world, but the real issue is the human capital and the capacity to care. It's the human connection. So background, if we think back a minute, we think clinical practice is really about relationships. Education is about relationships. Interprofessional collaboration is about relationships. And attention to core values made visible by skilled communication in all relationships is necessary for safe, compassionate healthcare. It's especially important in this time of COVID-19. We have limited communication with mask gowns and isolation, with limited communication with patient families. There's limited family access. There's healthcare worker fatigue and distress and stress. So I want to think a minute about everyday ethics in healthcare. Clinicians and patients live in the same moral universe. of universal human standards, being fair, respecting others, discussing the right thing to do in any given situation. And so those are everyday ethics, and those apply to how we treat patients and how we treat our colleagues. So I want you to reflect for a moment, to think here for a minute about your experiences and your experiences as a patient, and what do you think are the core human values that should be present in every healthcare interaction? So think a moment, drawing on your experiences and your experiences as a patient, what are the core human values that should be present in every healthcare interaction? And you can jot down a few ideas and we can discuss values at the round table. And I'd also like to ask you for a minute here, how many of you during your professional training, your education, any sort of training or education, were explicitly taught values? They were in the curricula, they were discussed, you wrote about values, you explored and discussed them. And then we'll think about values as the foundation of our work. So the concept is, values affect the way we see the world, the way we relate, and the way we communicate. So values in healthcare are the foundation of our work and of our work with each other and in caring for patients. Identifying values. The International Charter for Human Values in Healthcare was initiated in early 2011. It started as a collaborative effort to identify core values essential for healthcare interactions. The aim is to restore the primacy of core values and skilled communication necessary for practicing compassionate, ethical, and safe healthcare around the world. So how was the International Charter for Human Values in Healthcare developed? Well, it was initiated in early 2011. We asked clinicians, educators, linguists, researchers, communication experts, and healthcare leaders initially to identify values considered necessary for every healthcare interaction. Then we asked people in multiple groups and forums, literally from around the world. We included healthcare professionals, patients, caregivers, and asked them this question. Drawing on your professional experiences and your experiences as a patient, what are the core human values that should be in every healthcare interaction? Now, many charters are created by committees or selected people or organizational leaders, and this charter is different because it came from the input of many people around the world. It was a 3-year process using mixed qualitative methods to develop a framework of values essential for healthcare interactions. So we used combined qualitative research methods with expert focus groups, content analyses, iterative consensus, focus groups of the Harvard Macy Institute, faculty and scholars, Delphi methodology, and expert consensus. So what did we find? Well, as we analyzed the data, 5 categories of 4 core values emerged. And these are the values that people felt should be in every healthcare interaction. What we found is that they were similar around the world. There may be a different emphasis. Some people or places might rate one of these categories higher than another, but these were the 5 basic categories, or buckets of values, as you might call them, from around the world. Compassion, respect for persons, commitment to integrity and ethical practice, commitment to excellence, and justice in healthcare. We also looked at sub-values. For each of those 5 categories or buckets of values, we did sub-values. This is our example for compassion. You can see some of the sub-values of compassion: caring, empathy, self-awareness, motivation to help and heal, kindness, genuineness, generosity, flexibility in relationships, acceptance, curiosity, altruism, and mindfulness. The other 4 categories had a smaller number of sub-values, but compassion had the biggest. So we published the charter and information about it in Patient Education and Counseling, which is an international journal. This article has the preamble, the actual values and sub-values, partners of the charter, and also the methodology is described and some examples. So for those who would like further details or interest, I would suggest you go there. It is a free download. It is open access. And the URL, the short one, is http://is.gd/values-charter. So /values-charter. And you can get that information. So, how do we find our path in challenging clinical environments during COVID? So we're switching over a little bit to the clinical. So we have, in this pandemic, we have limited communication because of masks, gowns, isolation, social distancing. There's limited family access. In many countries, families can't be with family members if they're in the intensive care unit. There's clinician fatigue. There's moral distress in this pandemic environment. So what can we do to enhance relationships, communication, and compassion at this time and all times? So how can we find our path in these very challenging clinical environments during this pandemic? Well, we come back to our values. We have to rely on our values, our authentic selves, our motivation to help and heal, and our moral capacities. And when we're in what we call deep weeds, and we have to make impossible decisions, thinking about and focusing on our values and the patient's values can be helpful. For example, if the clinician is contemplating, the physician, removing a ventilator, there may be a clear answer, there may be no answer. It may be an impossible decision that could go either way. So we can go back to our values as a starting point. Is this decision compassionate? Is it respectful? Does it preserve the dignity of the patient? This won't give us the answer, but it will help us guide us in a certain direction. So, on another note, we have to find ways of communicating from behind the mask, of showing our care, our values, our respect. And this may help healthcare workers and others to regain some of their resilience. So if we can't cure, we can heal by being present, especially when patients are isolated and vulnerable and not in the presence of their family. So I teach faculty, physicians and other clinicians, and one of them said, "Our values are like roots. They hold us upright when they are present, and they can cause us to fall when they are absent or decay." The International Charter for Human Values in Healthcare provides a framework. It identifies and promotes core values, provides a framework for teaching and practice, and is used to incorporate values into the curricula of faculty development and clinical training programs. Relationships and skilled communication allow us to demonstrate these values. We enhance humanistic care by explicitly teaching values and evidence-based communication skills. So the goal is to explicitly teach values. And there are many ways to teach them. And the charter just provides one framework from which to do this. So we want to make values visible through skilled communication. We want to show them and role model them. We want to focus attention on values and explicitly articulate, teach, and role model values. And the charter is it's actually very important. It seems like a simple idea, but no one has really done it. And we've been working on it for 10 years, a group of us. And it's been developed by people and not a committee. So now we're going to shift gears a little bit, and we'll talk about what are we learning about all this from research. So we know that effective caring and communication is a major part of humanism and a major part of humanistic practice. And we studied factors that support or inhibit humanistic practice of healthcare. And I'll give you the definition for humanism in a minute here. So our current goals, we're doing a number of research projects, multi-sites, about 8 sites across the United States. These are academic medical centers affiliated with medical schools. So our research goals are to develop insights into factors that support or inhibit humanistic practice of medicine and healthcare. What are individual personal factors? What are organizational factors? And then the idea was to promote a culture of humanistic values at medical schools and academic health centers in the United States. So the research objective of this particular study I'm going to tell you about was to determine what factors and strategies enable faculty physicians to provide humanistic care despite the barriers. Methods, this was a qualitative study at 8 academic medical centers. These were physician faculty who had completed a 1-year faculty development program that we designed and taught at these 8 different medical centers to enhance their humanistic teaching and role modeling. We had a 74% response rate, and it was 59% female. 69% were less than 46 years of age. These were faculty, but tended to be more junior faculty, 85%. And about half were in primary care. So the 8 participating institutions, you can see them there. We've got Harvard, Indiana, Medical College of Wisconsin, Stanford, University of Colorado, University of North Carolina, University of Virginia, all the schools of medicine and academic health centers, and then Yale University School of Medicine. So we had quite a diverse group that we could really study across all of these institutions. So what is humanism? How did we define it? Well, we used the Gold Foundation definition that humanism is characterized by respectful and compassionate relationships among physicians, their patients, and other members of the healthcare team that flourishes within a humanistic culture. So humanistic healthcare professionals demonstrate integrity, excellence, compassion, altruism, respect, empathy, and service. So there are many definitions of humanism. This is the one that we used, and you can see that they're really imbued with values. So data collection and analysis, we collected data by semi-structured interviews where participants provided written reflective answers to 2 open-ended questions. One was, what motivates you to practice and teach humanistically? Second question, what were the barriers that limit your ability to be humanistic? So our data analysis, we used the constant comparative method of grounded theory to analyze the responses. And we were really looking to understand what enables faculty physicians to provide humanistic care despite the barriers. So what did we find? In looking at the motivators of humanistic teaching and practice, what makes a physician able to be humanistic in their teaching and in their practice, the most frequently noted theme was identification with humanistic values. That means it's who I am almost all study participants thought their humanistic values were the foundation of their professional identities. Another theme was providing the same care that I or my family want. Another was connection to patients. Many physicians expressed the belief that close, rewarding relationships with patients provided protection against burnout. And then passing on values through role modeling. And that was mentioned by many study participants as motivating them to sustain humanism. And then being present in the moment. And physicians felt that that would help diminish stress. So what were the inhibitors? Well, time. Time was a big one. It was ubiquitously cited by the study participants as a limiting factor, and also a host of logistical barriers related to providing insufficient time for patients. Stress was another one. Culture. There was a culture clash that these physicians articulated between business values and the study's participant humanistic values. So some expressed a determination to practice and teach humanistically, but viewed themselves as swimming upstream against the dominant culture. So humanistic care was often at odds with the policies designed to improve efficiency and productivity. And then episodic burnout. Participants use the word burnout to describe feelings transiently associated with times that they are stressed and overbooked. To give you a deeper sense of some of the themes, I want to share with you quotes from physicians, and we've picked fairly common quotes for each of the themes. So for the theme of identification with humanistic values, one physician said, "I saw myself as the kind of doctor who was contributing to the good of the world," or "it is who I am." For the theme of providing the same care that I or my family would want, one of the comments was, "to treat others as you'd like to be treated." And then connection to patients. Connection leads to satisfaction and rewards of doctoring. And then passing values and passing on values by role modeling. One of the quotes was, "to serve as a role model motivates me to teach humanistically. This pushes me to show humanism to my trainees, no matter how stressful or how busy things are." And then being in the moment. If one believes that clinical care is of utmost importance, patients are treated with one's full attention and the respect that they deserve. And then to share with you some of the themes about barriers to humanistic practice, what inhibited humanistic practice and teaching. So time, resources, insurance, paperwork, and the electronic record. That was a very common quote. And stress. Physicians said they were drained by heartbreaking situations, distraction, stress, anxiety, and demoralized by busy work. And then culture. A culture that seems to value research and clinical productivity over humanistic care. Perverse culture fosters cynicism and anger. And then the last theme, episodic burnout and discouragement. Surrounded by colleagues who are burned out. I have also been burned out. Burnout makes practitioners not practice humanistically. And I want to note this study was actually done before COVID, and COVID exacerbates, makes worse the barriers to humanistic care. So we believe that it's even more applicable now, even though the study was actually done before COVID. So discussion. This study is a qualitative analysis of physicians' reflections and perceptions to examine what factors and strategies enable faculty physicians to provide humanistic care despite the barriers. The physician participants voiced their commitment to being humanistic in spite of facing multiple barriers, And the sustaining factors included a deep sense of responsibility to be role models, to pass their humanistic values and the rewards of humanistic practice to their students, and to teach the benefits of therapeutic physician-patient connection and relationships. This is what was quite important to these physicians. So there was a determination to live by one's values embedded within a strong professional identity, and this allowed the study physicians to alleviate but not resolve the barriers to humanistic communication and care. We found that humanistic care was often at odds with policies to improve efficiency and productivity, and there was a cultural clash between business values and study participants' humanistic values, which highlighted as a perceived organizational barrier. And then collaborative action to address organizational barriers was endorsed, but found to be lacking. So our take-home points, challenges, we talked about challenges of relationships and communication in the time of COVID. We talked about the importance of attending to values, to pay attention to them, as they are the foundation of care. Gave you a brief look at the International Charter for Human Values in Healthcare, which is one framework for teaching and practice. Cultivating relationships is key. And our research has reinforced the importance of attention to values. So we'll put some references, I think, in the chat during the roundtable so that you can look at them. Just have about 5 here. And then thank you. I want to thank you. It's been great to participate with this, and I'm looking forward to the roundtable. And I will leave you with one comment here. You must be the change you want to see in the world. That's by Gandhi.